Heart disease remains the leading cause of death among older adults in the United States. But what's truly alarming is that many people don't even know they have it until it's too late. Why? Because heart disease often doesn't scream for attention. It whispers, it hides, and it sends out subtle, silent signals that are easy to ignore. In this video, we'll explore the 5 silent signs of heart disease that every older adult and their family should know. Recognizing these signs early could save your life or the life of someone you love. Chapter 1. Fatigue that doesn't go away. Have you ever felt exhausted even after a full night's sleep? Or you wake up already tired, struggling through the day with low energy, brain fog, and a constant desire to rest? This kind of fatigue, one that doesn't go away with rest and just about being tired, it's a warning sign. And for older adults especially, it can be the body's way of saying something deeper is going on beneath the surface. Persistent fatigue can be caused by a wide range of factors. It may be physical, like heart disease, anemia, thyroid problems, or even diabetes. When your heart isn't pumping efficiently, or your blood isn't carrying enough oxygen, your body has to work harder just to perform basic tasks. And that can leave you feeling drained all the time. But fatigue can also be emotional or mental. Depression and anxiety, often overlooked in older adults, can lead to chronic tiredness. These conditions don't always show up as sadness or nervousness. Sometimes, they simply show up as low energy, lack of motivation, or feeling like everything takes too much effort. If you've lost interest in things you used to enjoy, or you find yourself isolating from others, these might be signs of emotional burnout hiding behind physical fatigue. There are also lifestyle factors to consider. Are you eating a balanced diet with enough nutrients? Are you staying hydrated? Are you getting regular physical activity? As we age, our bodies become more sensitive to poor habits. Eating too much sugar, skipping meals, or leading a sedentary life can all contribute to exhaustion that never seems to go away. Sleep disorders like sleep apnea are another hidden culprit. Many older adults experience interrupted sleep due to breathing problems at night. You may not even know it's happening, but if you snore loudly, wake up with a dry mouth or headaches, or feel groggy despite 8 hours in bed, it's worth getting checked. So, what should you do if you're experiencing fatigue that just doesn't go away? First, don't ignore it. Chronic fatigue is not normal, and it's not a part of just getting older. Talk to your doctor, get a full checkup, including blood tests, heart checks, and a review of your mental well-being. Keep a fatigue journal to track when your energy dips and what might be causing it. Your body is speaking to you. Don't silence the message. With the right attention and care, you can find the root cause of your fatigue and reclaim the energy and joy you deserve at any age. Chapter 2. Shortness of breath even at rest. Have you ever found yourself struggling to catch your breath even while sitting still or doing nothing at all? Shortness of breath at rest is not just uncomfortable. It can be a serious red flag that your body needs help hand fast. Normally, we expect to feel out of breath after climbing stairs or going for a brisk walk. But when you feel breathless just sitting on the couch, lying in bed, or walking to the bathroom, it's time to pay attention. This kind of unexplained shortness of breath could point to an underlying medical condition that shouldn't be ignored. One of the most common causes is heart failure. When the heart is weak, it can't pump blood efficiently. This leads to fluid buildup in the lungs, making it harder to breathe even when you're at rest. You might also notice swelling in your legs or ankles, fatigue, or waking up gasping for air at night. Another possible cause is a lung condition such as chronic obstructive pulmonary disease, or COPD. This includes chronic bronchitis and emphysema, often linked to a history of smoking or exposure to air pollution. When your lungs are damaged, they can't move air in and out the way they should. That can leave you feeling like you're suffocating even when you haven't moved a muscle. Blood clots in the lungs, known as pulmonary embolisms, can also cause sudden, intense shortness of breath. These are medical emergencies and may be accompanied by chest pain, coughing, or a rapid heartbeat. If you experience any of these symptoms, don't wait to seek immediate medical attention, but sometimes the cause is less obvious. Anxiety and panic attacks can create a feeling of breathlessness that's very real, even if the lungs and heart are healthy. And certain medications, obesity, or anemia can all contribute to feeling out of breath. The key is not to guess. If you're experiencing shortness of breath while at rest even occasionally, it's time to take it seriously. Keep a journal of your symptoms. When does it happen? Is it worse at night? Does it come with chest pain, dizziness, or fatigue? Bring this information to your doctor. A proper diagnosis may include blood tests, a chest X-ray, an ECG, or even a lung function test. Breathing is something we take for granted until it becomes a struggle. Don't ignore the signs. Your breath is your life, and if something is interfering with it, your body is asking for help. Listen closely and take action early. Chapter 3. Swelling in the legs, feet, or ankles. Have you noticed your shoes feeling tighter by the end of the day? Or maybe your socks leave deep marks around your ankles. Swelling in the legs, feet, or ankles, also known as edema, is a common issue, especially in older adults. But while it might seem like just an inconvenience, it can be a sign that something more serious is going on inside your body. Swelling happens when fluid builds up in the tissues, usually in the lower part of the body due to gravity. This can be caused by something as simple as standing or sitting too long, especially in hot weather. But when swelling becomes frequent, painful, or severe, it could point to underlying health problems that shouldn't be ignored. One of the most common causes is heart failure. When the heart can't pump blood efficiently, fluid starts to collect in the legs, ankles, and feet. You might also notice shortness of breath, fatigue, or a rapid heartbeat. These are red flags and they mean it's time to see your doctor. Swelling can also be linked to kidney disease. When the kidneys aren't filtering fluid properly, it can back up in the body, often showing up first in the feet and ankles. Similarly, liver disease may cause swelling due to low levels of proteins in the blood that normally help keep fluid in the bloodstream. Another possibility is chronic venous insufficiency. This happens when the veins in your legs become weak or damaged, and they struggle to return blood back to the heart. The blood pools in the lower legs, causing that heavy, swollen feeling. Over time, this can lead to skin changes, ulcers, or a burning sensation. Certain medications, such as those for high blood pressure, diabetes, or pain relief, can also cause swelling as a side effect. And let's not forget about lymphedema condition, where the lymphatic system is blocked or damaged, leading to a thick, heavy swelling, often in one leg more than the other. If you notice swelling that doesn't go away overnight, or if it's accompanied by pain, redness, or warmth, don't ignore it. Sudden swelling in one leg can be a sign of a blood clot, which is a medical emergency. So, what can you do? First, talk to your doctor. They may recommend blood tests, imaging studies, or lifestyle changes. Elevating your legs, reducing salt intake, staying active, and wearing compression socks can all help. Remember, your body is always sending signals. Swelling is just a cosmetic issue. It's your body's way of asking for attention. Listen to it, take action, and protect your health one step at a time. Chapter 4. Mild chest discomfort or pressure. It often starts as something subtle, a tightness in the chest, a bit of pressure, or an uncomfortable feeling that comes and goes. It's not sharp pain, and it's not unbearable, so you brush it off. Maybe it's just indigestion, stress, or a pulled muscle. But here's the truth. Mild chest discomfort or pressure should never be ignored, especially if you're over 60. Many people think that a heart attack always comes with crushing pain, sudden collapse, or dramatic symptoms. But in reality, heart problems, especially older adults, can start with much quieter signals. A mild pressure in the chest that feels like something heavy is sitting there, a dull ache that radiates to the arm, neck, or jaw, a little shortness of breath when climbing stairs. These symptoms might seem minor, but they could be early warning signs of heart disease. For some people, especially women and older adults, heart attacks can present without typical Hollywood-style chest pain. Instead, they may feel discomfort, fatigue, nausea, lightheadedness, or cold sweats. This is why so many early warning signs go unnoticed or are misdiagnosed as heartburn, anxiety, or simply getting older. Mild chest discomfort can also be caused by other serious issues like angina, which is reduced blood flow to the heart. Angina often appears when you're active or under stress and fades with rest, but it's not something to ignore. It's your heart's way of saying, "I need help." Left untreated, angina can lead to heart attack or heart failure. Of course, not all chest discomfort is related to the heart. It could be caused by acid reflux, muscle strain, or inflammation of the chest wall. But how do you tell the difference? The truth is, you can't always know on your own, and guessing could be dangerous. So what should you do? If you feel any kind of chest pressure, tightness, or discomfort, especially if it lasts more than a few minutes, comes back repeatedly, or occurs with shortness of breath, sweating, or dizziness, don't wait. Call your doctor or seek emergency care. It's better to get checked and be safe than to overlook a serious issue. Your heart is your body's engine. When it speaks, even in whispers, you must listen. Taking action early, even when symptoms are mild, can save your life. Chapter 5. Cold sweats, nausea, or lightheadedness. You're sitting comfortably, maybe watching TV or reading a book, when suddenly you break out in a cold sweat. Your skin feels clammy, your stomach turns queasy, or the room starts to spin. You feel dizzy, maybe a little faint. It's easy to blame it on something minor, maybe something you ate, or a warm room. But when cold sweats, nausea, or lightheadedness appear suddenly and without a clear reason, they could be early signs of something far more serious, possibly a heart problem. These symptoms are especially dangerous because they don't always feel urgent. They creep in quietly, without the classic chest pain we often associate with a heart attack. But for many older adults, these silent symptoms are how the body signals distress, particularly when it's the heart that's in trouble. Cold sweats are caused by the body's fight or flight response. When the heart is under stress, like during a heart attack, it triggers a nervous system reaction that can make you feel clammy, sweaty, or chilled, even if the room isn't warm. Nausea and even vomiting can also happen because the heart and digestive system share nerve pathways. So, when the heart struggles, your stomach often reacts too. Lightheadedness or dizziness is another warning sign. It may feel like you're about to faint, or as if you're floating or losing balance. This can happen when your brain isn't getting enough blood flow, often due to a drop in blood pressure, irregular heartbeat, or poor circulation from a weakened heart. These symptoms are especially concerning if they appear suddenly, come with fatigue, or are paired with other signs like chest discomfort, shortness of breath, or pain in the arms, back, or jaw. But even on their own, they deserve immediate attention. Many people hesitate to act because they don't want to overreact or cause a scene. But when it comes to your heart, hesitation can be dangerous. Don't wait to see if you feel better in a few minutes. If you experience cold sweats, sudden nausea, or unexplained dizziness, especially if you have risk factors like high blood pressure, diabetes, or a history of heart problems, seek medical help right away. These symptoms may be your body's only warning before a serious event occurs. and early action can make all the difference. Remember, your health is worth protecting. Pay attention to what your body is telling you and don't ignore the quiet signs that something serious may be happening. Final recap. Know the silent signs. Let's recap the 5 silent signs of heart disease in older adults. Unusual fatigue, shortness of breath, swelling in legs or ankles, mild chest discomfort, cold sweats, nausea, or dizziness. These signs may not seem urgent, but together, they can paint a clear picture of heart disease quietly developing in the background. Heart disease may be silent, but you don't have to be. If you or someone you love is experiencing even one of these symptoms, don't wait for a crisis. Early action can mean a longer, healthier, more active life. Talk to your doctor, ask questions, get screened. Because when it comes to heart health, knowledge is not just power, it's protection. If you found this video helpful, share it with a friend or family member. You might just save a life. Thank you for watching, and take care of your heart. It's the engine of everything you do.